I would caution that we just observe something working in the non-healthcare space and just run towards it and then actually bring it into the healthcare space without actually thinking it through. Throughout the conference here today, Alexa was mentioned several times, or just interactive kind of voice recognition type technology. And the implications for that potentially are huge. I'm not going to take away from the potential, but rushing to that conclusion that it's immediately applicable in a clinical environment, we have to take into consideration all of the kind of inadvertent effects of something like that happening. We joked actually earlier about the news story that came out where news anchors were talking about Alexa on TV, and the Alexa within someone's home was being activated and inadvertent orders were actually being sent. You can imagine the chaos that would ensue in a healthcare environment if something like that were to happen. So I think there's a lot that we can learn in healthcare from kind of the non-healthcare space, but we do have to remember that it's actually a very, very different space within which technology has to behave somewhat differently than it does in others. From the hospital's perspective, when it comes to evaluating technology, it's less the technology itself, but the process that went into developing that technology that's important, I think. Getting physicians or the end user involved early and often will lead to much more productive solutions than building something for a perceived use case and then trying to basically impose that workflow onto someone that may not be a natural fit. So in our experience, if we actually take physician or healthcare provider feedback at the front end and allow those folks who ultimately will be using that technology to shape how that technology is developed, it leads to a win for both ends. Yeah, I would say if you break it down to its root, new technologies can often just add time to a healthcare provider's day. So physicians generally will learn a way to do something, and it's not that they are not eager to innovate, but they optimize how they're doing things in order to make it as easy to accomplish as possible. If you introduce a new technology that doesn't accommodate that or doesn't understand the context within which it would be used, it can actually paradoxically complicate things for the provider. So it's imperative to actually try and focus on the endpoint of that technology, not only being use, but actually time saved for the physician, and that will compel them a lot more to actually engage excitedly.